everybody to the Recovery Clinic. It's a place where we do recover. It doesn't matter what external challenges we face. We can find the power through our therapeutic community to overcome any challenges together. It's actually on our sign, we do recover. I've got, these two are amazing people with me. I noticed that, probably noticed that you don't see Jimmy McGill. He'll be in the comments today. We'll look forward to hazing him a little bit, won't we?
Yeah, of course.
But, we, due to limited capacity, we just want to remain safe and do the right things. And so Jimmy had my back last week. I have his this week. And I'm grateful for this opportunity because John and Carol Shinholser are in the studio today. We're going to talk about the McShin Foundation. We're going to talk about Carol's work in the political arena, advocacy,
Washington, D.C.
all of her work in D.C. We're going to talk about natural state recovery here in Arkansas. And so obviously we have a lot to talk about. But why don't you just give our viewers a little bit of a... John, you've been on the show before, so some of us may remember you watching. But why don't you just give a brief introductory of
Well,
what
real
you do.
quick, I'm John Shinholser, a person in long-term recovery from substance use disorders. For me, that means I've been clean a little over 38 years, almost 39 years. President and co-founder of the McShin Foundation in Richmond, Virginia, Virginia's largest authentic non-government organization in this space. And but my most important role is I'm married to the beautiful Carol McDade over here on my right. So that's the
You've
big
been
hit
trained.
today. I've been trained well.
He has been trained. My name is Carol McDade. I'm also a woman in long-term recovery. And for me, that means I've been alcohol and drug-free for over coming up on 23 years. And my recovery's allowed me to become a wife and a mother and a full-time advocate in Washington, D.C. for those who are in or seeking recovery from addiction and mental health disorders. Glad to be here today.
We're so happy to have you. A couple powerhouses.
Oh,
Last time I saw you two, we were at your house having dinner with Miss America and Dan the pharmacist.
Right, the pharmacist, right.
That's right.
You had the. Why don't you talk to us about that fundraiser that you have though for the McShin Foundation? Because
well, every year we do a recovery fest in September,
Recovery Fest.
National Recovery Month, and we always bring folks in to help promote and profile it. And something I learned from Carol about 20-something years ago, by hanging around her, you learn about these events. And Dan and Camille, they came just to highlight the need for recovery and whatnot. But it was a great time. You and Jimmy came up. We had a good time.
We were excited.
We ate good. We recovered good. We launched our memorial garden that day, which was a solemn experience. But we're really glad y'all were in the house. And Carol give you a little background on Recovery Month. She knows a little bit more about that.
Yeah, it's actually in the process of evolving right now. But for many, many, many years, over 25 years, the federal government, the Substance Abuse and Mental Health Services Administration, has historically sponsored Recovery Month, and that is they use the whole month of September, and people around the country do events, various kinds of events. I know y'all have done them here in Arkansas.
Yeah, I've been to some. They were good, man.
Yep, and so that happens. You're part of a nationwide network where that happens in September. Some people let it slip to the first couple days in October. And recently...
we wouldn't put that past the recovery community to stay past the welcome, right?
Right.
Exactly. And so this year, or last year, the federal SAMHSA kind of turned that over to Faces and Voice of Recovery to do. So
That's
the
right.
private sector will be starting to manage and run that. And they've always played a big role in supporting and enhancing by having one hub event where over 30 or 40,000 people tend to show up every year. So, and then there's multiple events all around the country.
Yeah, little breakout.
We got to bring a hub to Little Rock one year.
We should.
Well, you daggone right we should, man.
We've got the community, that's for sure. I want to go back though when we to the memorial garden.
Right.
Jimmy and I are driving up. And I had never been to the McShin Foundation before, so I was excited to see it. We're driving up down the road, and there's a sign that says 3,500 a year.
Every year in Virginia, over 3,500 people lose their life to addiction, whether it be overdoses, alcohol, benzos, whatever.
Yeah.
The combination of all the abused drugs, minimum
3,500 people.
are dying every year. And that doesn't count tobacco.
Preventable.
Well, preventable. You're right. You're right.
And so I mean, that was very moving for me to see that. And then right behind it, you see all of the loved ones who are putting the stake in the ground and honoring that person's memory.
Right, the Marker Project. You saw the Marker Project. We take that all over the state, and Alaska's starting to mirror that too. So others,
we will be soon.
Well, good. Other states mirror the Marker Project.
It's just so moving. I mean,
it's powerful,
the families
powerful.
need that
They
outlet,
do.
and to just have that. So what that is, the Marker Project. Can you share a little bit about that?
Well, the Marker Project was something we come up with a few years ago. We wanted to. It's a visual on the impact addiction's having. Like a lot of people do the posters with the pictures of the kid. Remember I come down here and they did the posters out at the lake? Yeah, I thought it was a fabulous visual. You got to have visuals. People got to see this. So we just use the markers where we're at, and it really it's a touching visual.
Yeah, I put someone
and then we want to take it all over the state and put it in high traffic areas. Put it in front of these politicians' districts and naysayer districts but allies too. But if we don't continue to battle the stigma associated with addiction, we're not going to get nowhere. Stigma is still killing as many people as the drugs are. So stigma is a big deal.
And I think doing it, we of course did it during September, but to honor Recovery Month, but doing it when you've got like a big road race in town that draws people from all over the state. John and his team were clever enough to do it on the biggest road
marathon.
Oh, there you go.
Right.
Yeah, and it got a lot of eyeballs.
We do it year round. I mean, we'll take it places year round.
But when you can do it during a big community
I just
event.
love the creativity to honor someone in that way. One of the things you mentioned, stigma. When we had our groundbreaking in 2019 or early 2020 for the campus that we started, where we have our medical detox and our residential, we bought a high school campus, right?
Wow.
And so in the gym we had this groundbreaking, and instead of the traditional little shovel and hard hat thing, we built a wall and wrote stigma on it in red, and the governor, the AG, a whole bunch of other people, our staff, we had a chance to take a hammer to it and literally take the wall of stigma down. To be a symbol.
Oh, that's good.
Here's the thing, though.
Tear down that wall.
Yeah. Here's the most moving part that I wasn't expecting. I started getting calls and messages from mamas and daddies who lost their kids to an overdose, and they said that was so therapeutic. I wanted to just take that wall down. And I was like, oh, we need to do these everywhere then.
Yeah.
Because I wasn't expecting that, but
gives them an outlet.
Yeah. So I'll trade you. I'm going to take the marker, and you can take the wall. Stigma.
Yeah, there you go.
I see our CEO's watching today. Honesty Lilla, CEO of McShin. She's hard at work, I'm sure, but if she had time to tune into our conversation, she ain't so hard at work. But anyway, good morning, Honesty. It's probably afternoon there now.
I know Jimmy's in here.
Yeah,
He's in there cussing,
Jimmy don't
saying,
go far.
McShin kicks butt.
Yeah, I've been told not to cuss today, so I won't say much. But one thing I was wondering, Chris, earlier we were discussing, what do you want to talk about? And I like that little topic we were hit on earlier where, is there anything we can expect out of the new administration in Washington, but as well as where the recovery movement's going to be going, where our services are going to go, what can we expect? Because I think that's an important discussion to have.
I think there's a lot of new faces in the movement, and so my hope would be we continue to pull in the right direction. And right now, where you have all this momentum and energy,
incredible momentum everywhere I go, it's amazing. I've never seen it like this before.
Yeah, and so I think that with the changing of the guard and the new administration, I know that we were talking about there's not a lot of access right now, which unfortunately, there's still some trench work to be done.
Yeah, there's COVID restrictions, but that doesn't keep you from advocating with your member of Congress or
because
their
Zoom
staff
exists.
members through Zoom.
Yeah.
But
so talk to us a little bit about your advocacy work and kind of the things that you hope to see implemented with this new administration, and then maybe if you see something that you loved from the previous administration, hopefully how you see it being carried forward.
Is there anything good happening right away,
Right.
Well, I think there is. Most people, if they read watch news on any platform have seen that there's a COVID relief bill that has passed the House and is pending in the Senate. And it's like normal, like we're supposed to have. It's going to be a deliberative debate in the Senate with lots of different people having different views about the price tags and all of that. But if a COVID relief bill passes, and I think it will, it's got billions of dollars in there for addiction, with the B, for addiction and mental health. And I think that to kind of get ahead of I know the way that John's thinking, how much of that will really be spent on recovery support services, things like housing, recovery high schools, collegiate recovery, you know, all kinds of
evidence-based treatment.
Yeah, recovery community centers.
And that's where you come in.
Yes, and I think that that is where our work is cut out for us historically. Most services for the indigent in this country get funded by the federal block grant. There's very little of that money going directly to recovery support services. And I think that's been an ongoing challenge that we'll see continue. But there is a recognition that COVID has made the addiction problem worse. We had over 80,000 people die nationally last year. It's the largest number that's ever been recorded. And so there is a recognition. The suicide rate is up, not only for veterans, but for the general population, especially teenagers.
That's an incredible number.
Well, it was going up before COVID too, though.
More specifically, though, the reason why to me it's an incredible number, tragic, is because over the last few years, Narcan has been pumped everywhere.
Yeah.
Well, fentanyl. It's hard
That's
to
what I'm
combat
saying,
fentanyl,
right?
though.
But even that big wall of Narcan being trained in law enforcement.
Well, there's been an increase in usage,
right?
So the Narcan might have just caught up with that.
Yeah.
But the fentanyl, now that we got fentanyl on every street corner, I mean, how do you combat against something that deadly? You can't.
No.
You either got to stop it at the head of the well. Congress got to quit letting that product in the country. Or, and let me say that again, Congress has to quit letting that product in the country, or we're just going to have to run out of addicts that die from it or something, because there's not going to be nothing in between, because the kids are still going to go do drugs. So as long as we let that drug in this country, we're going to have that problem.
Yeah,
But,
I mean, it doesn't. I mean, it's quick.
Well,
I mean,
It
it's an experiment.
You got
3 times as much Narcan
Yep.
to wake somebody up from fentanyl.
well, in a lot of cases it won't work. You know,
Or
it's just too strong.
needing to be given after that you first seen the person.
That's the focus.
And recovery's harder to get on fentanyl, because remember, in order to take Suboxone, you got to be off a drug 24 hours, but fentanyl is 48 hours, so you don't get sick if you start an induction of a Suboxone. Yeah, who wants to wait 48 hours? So it's a complicated drug, man.
That's a long time. We all know that. A lot of us watching know
long
that.
time to
Right.
suffer.
Yeah.
But on that COVID relief bill, I heard a state like Virginia might get $700 million for the whole state, and then I've had a state senator tell me, well, he's trying to get $10 million of that to the recovery space, not the standard, you know, tax-funded agency space, but the actual authentic non-government recovery space. So if,
Let's be clear about this. There's not an us and them here thing between treatment, prevention, and recovery. It's just that we want an equal part of the funding.
Yep.
It's all necessary.
Yep.
Just like it would be if you had cancer, diabetes, asthma. There's a continuum of care that a patient needs to get and sustain wellness. And it's the same for addiction, is that you need that full continuum of care. And so we need prevention, treatment, and recovery all funded. And right now, I think many of us would like to see a set aside in the federal block grant specifically for recovery support services.
provided by non-government organizations,
Right.
not the same old
Exactly.
players,
Yeah.
you know.
And I think that a state like Arkansas is a perfect example. Y'all have funded recovery support services a little better than where we're from in Virginia, for example.
Yeah, so what I like about R&D is it's not research and development, it's rip off and duplicate. So I think that, you know, you have
Is it where he's at?
you have a governor here that believes in second chances and has been on our show and has talked about some of the addictions that have been in his family. So he's been able to see it. And then he appoints Kirk Lane, the state drug director, who runs into Jimmy McGill at an overdose awareness day, and Jimmy's unrecognizable.
And Jimmy said, look, we just need $10 million alone for sober homes in Arkansas. I'm with you 100%, Jimmy. You're right on the money with that.
Yeah.
Minimum $10 million sober homes, Arkansas.
You know what I mean?
I'm gonna wave the wand.
There's these things that just kind of happened, but ultimately, the state took a chance on Jimmy McGill. 19 felonies.
That's a no-brainer. The guy's a wizard at peer recovery
you know
support.
What I mean, though? Like
yeah.
everyone's saying that now.
Yeah.
Well,
That
even
we're
back
behind- well,
then.
no, they were saying, I don't know what we're doing.
But
No,
we
had-
make the best peer leaders, the
well,
felons,
he had,
you know.
Yeah, but he had Kirk Lane and
Right.
went to bat for him.
Yeah.
And took that. And
Well, that's
shouldered it.
important that they go
Sure.
down that road, but so they can see that our best peer leaders are going to come from the system.
They had to be taught.
Yeah.
Well, and
Right.
right now,
But,
you
you know,
see
like-
the federal government doing that too. We've got Tom Coderre,
That's what
who's
I'm
a
saying.
person in open recovery, as
Putting
the acting
people
head of
in
SAMHSA,
recovery at the table.
Office of
to
National
hear it.
Drug Control Policy, senior advisor Tom Hill, he's in recovery. We've got
And are you, so that was what I was going to, that's why I was talking, sorry for being long-winded, but I was going to bring that up because I've seen it in our state where we've put recovery at the table to have a voice. Are you seeing, is this the first time you have
No,
a Tom?
We had Michael Botticelli,
That's
who was
right.
the former drug director under President Obama. He's a man in long-term recovery.
You have Don over at CPAP or something.
Yep, and you've got Donna Dimitrovic, who's at CSAP at SAMHSA, which is the prevention arm of SAMHSA.
So it's not,
This is not
it's not
new.
making history
There's just
per se, there's more.
It's
of
carrying
them.
on. It's doing what needs to be
More of
done
them,
all along.
And I would say there's a difference between a person that is a member of the organized recovery advocacy community and just a person in recovery. You follow me?
Sure.
One has been steeped in advocacy and helping pass laws or regulations that help others who are seeking recovery. And another person is just somebody that, nothing wrong with this, but they're not politically active at all. They're not out in the community helping more people get the same chance at a new life that they've got.
Right.
So we're not just putting people who are in recovery as a
No, these
token
have-
at
yes.
the table. These are people who are steeped and have spent their careers in
That's a
advocating for
great
others.
clarification.
Do y'all have those PARI people down here, the police education assist, you know, where folks can go
The
into
angel programs that
yeah,
law enforcement
like-
do, you can walk into a fire station or a police station
and get help?
I think we have crisis stabilization units. I
Okay.
think that's what
Well,
that
like
is.
up, like all
But you
across.
can go in there anywhere and
yeah.
get help.
Well, all across the country, they're starting to where if an addict or an alcoholic needs help, they can go to a policeman or fireman and say, I need help, and then they get them the help they need. But the peers are everywhere in some states.
Yeah, we've implemented them everywhere here.
You know,
They're in
but
hospital, all the high vulnerable areas.
they're
Our
starting.
program's just, I mean,
Incredible, tremendous.
well, I mean, it's just, it's ingrained. I mean, it's not like we've added it, we've built it
Right,
around
you've
it.
embedded
And
it.
there's a federal
Yeah,
grant
embedded.
program for peers in emergency departments, just
That-
in
they're-
case y'all haven't taken advantage of
They're
that.
here. Jimmy, are there peers in hospitals?
Oh, I know you got to have
And
some
jails.
somewhere,
I
but
mean, are
you want them
they
everywhere.
funded by the federal government? That's what
They
I'm
are.
saying. Okay.
They got
It's
game
SOR.
down
Yeah.
here actually, but anybody in
But
Arkansas.
what we want to see is the hospitals start to take those over.
Exactly. And
And
it
that's
not
where
have
there's
to be
little-
a discretionary
There's a little bit of a
grant
bridge.
program.
Yeah.
So anybody at any time can just ask, really anybody, and get help, get off the street, get into sober living. They got that model set up here pretty good, or it's,
I mean, it needs to be polished up.
it
I
need-
think we have the framework, we have the people. We just have to
Just
put
this-
the meat on the bones.
right. So you probably got not enough capacity for the need right
I think it's
now.
fragmented. It's
Right.
not
Yeah.
organized.
Well, see, that's a good goal for Arkansas. Let's top all these loose ends and let's integrate everything and let's make it so. Like I was talking to one of our state senators, John Bell, the other day. He said, "John, we got so much money coming to Virginia that if we don't get this right in the next few years, we'll never get it right
Never.
because they got the state opioid abatement authority money coming.
From the,
We got
drug companies
COVID
settlements
money
that they would
coming.
manufacture.
They got marijuana
starting to see those come in?
legalization money coming.
It's coming.
Okay.
I mean, they got
It's
what's coming to Arkansas too. Y'all getting ready to get a pocket full of
I
money.
think, yeah, I don't know, the funnel's maybe a little different. So it comes to the AG's department, and then I think the AG's department gives it to an organization too.
No. The one I'm talking about is every state that gets this particular piece of money, they have to create, through state legislation, an abatement authority. And it's the abatement authority that dishes out the money. That's the
how
one
we're
I'm...
doing it in Virginia. That's not
No,
how it has to be
that
done.
all 50 states got to have an abatement authority passed by legislation. So
Kinda
that's
like, so for
like
instance,
tobacco settlement money.
But Chris is just saying that it's run by the AGs.
No, not the one
We may
I'm
be talking
talking
about
about.
different.
Yeah, but there are other settlements that would be AG delegated, but the one I'm talking about has got to be legislature
I think
created
I've heard
abatement.
I haven't heard that specific term, but I think out of the
Well,
drug
that's the
director's
way my
office, they're
AG
talking
explained
about
it to
putting
me.
together a board or a commission. We have the marijuana commission that has to approve, and that had to go through
Well,
the
we just
legislative
created
body.
one of those in Virginia,
Yeah.
marijuana commission.
Yeah,
So,
to be able to approve license to grow.
but that's
and
more like an
dispense.
alcohol type model.
Sure.
But the abatement authority is more like the tobacco settlement model,
right.
you know. But this time they're making it so that, like in Virginia, 70% of those dollars has to go to treatment, recovery,
Yeah.
something along those lines, you know. But the point is there's multiple buckets of new funding for recovery.
Right.
Yeah, and the senator hit the nail on the head if we don't get it right now.
Well, we just may as
Because we'll
well.
never get this much investment in this space again.
No, we were
just
talking about
won't.
all eyes are on this right now. And the
Yeah.
people in the trenches, you know.
And you know the special interests,
Make it happen.
they do not like to see a lot of their business go away. You know, there's a lot of panic out there. Oh my God, they're gonna do expungement laws. Oh my God, they're gonna not lock up these low-hanging
That's the shift we
criminals anymore. I mean,
So talk to us about the McShin Foundation.
well, in a nutshell, it's just
When it was
it's
founded,
well, in 2004, me and Carol were at a 12-step camp out, and we said, man, we need something. We got to do something. All these poor guys and girls are, you know, they come to meetings, they're staying clean, but they can't make it 24 hours because there's nothing for them to do. And we said, well, let's start a recovery organization like they're doing elsewhere in the country. And that was on a Saturday, and on Monday we started it. So that's kind of how that got started.
Well, what John's leaving out, though, is we, at that time in our state, and thankfully the number has shrunk some, but there was a 25-day waiting list to get any help at all.
yeah.
And John was bringing people home to the house, and we were starting to run out of sofas for people to sleep on. And so that was the other thing, is that the need was so much greater than we had personally had the capacity for.
Right.
And
When you
so-
step out into this space and make yourself available, you really do see it.
Well,
And if you're, I mean, we need genuine people in this space. It's, you know.
Well,
we were in recovery full time anyway.
All right, yeah, of
I
course,
mean, so
but-
we're already in the space.
But
mean,
I was the
but
type
I've-
of person that would have a business plan. I would have pick
Yeah,
my
yeah,
board
I
of
remember you saying
directors
that.
early.
Right.
You just
And
did
then
it.
John,
He's the hammer.
He calls me and says, hey, you know what we were talking about this weekend? I got it done. And I was like, God, what done? And I
Your
was
heart
afraid
sinks a
that
little
I
bit.
knew, that it was this. And
No,
he
what
said,
I
no,
said
I just
was
left the lawyer's office and got our
no, I called her before we were
501c3.
going to the lawyer's office. I'm
called me
heading to the
after.
lawyers. I said, what do you want to name it? I don't know, maybe before, but we didn't have a name. No, because we had to have a name to go into it. I mean, you know, the older you get, the further removed, the foggier things are. But the way I see it, I called her on the way in the lawyer's office and said, what do you want to name this thing? And, you know, she started to argue and complain, you know. So, but it worked out pretty good.
It's
So,
a combination of our two last names.
Yeah.
I'm McDade,
Yeah.
he's
Yeah,
Shinholser,
that's
so
great.
that's how we got
That's
it.
great.
and then the first volunteer I had was an old AA guy that worked for the state of Virginia in charge of systems analysis, right? and he came in one morning to help me. He said, John, you don't have no system around here. I said, what do you mean a system? We're just here to help people. We don't need a system. They come in, we talk, they talk, we listen, we do what we can. He said, John, you need a system. I said, man, just talk about the steps and traditions. That's our system, you know. Now we're a multi-million-dollar a year
It's
charity.
impressive. And you see the impact. I
Oh,
mean,
totally.
a Recovery Fest. I'm so glad that I got to witness the McShin Foundation on that day, and just to see the whole organization, and then the people. That's what it's all about.
Well, that's the
all
hit.
the people that were. I mean, we went into the sober livings and
right.
all the people. I mean, it's
You know, Richmond has probably 1,000 sober beds. You know, many different providers, but half of them came through McShin. They're McShin alumni. They like the space. They want to be in it. But the point is, recovery is contagious in Richmond. And recovery is contagious in Arkansas, too. You know, we're making recovery the epidemic, not the drug the epidemic. So what's happening here is happening there, and vice versa. But that's what you tapped into and you like so good. Just the recovery, people helping people need and get recovery. I mean, that's just an amazing model. And that's, I think, is the future. That's where America needs to be.
I think we're in the dust of the ring right now, and when it settles, all of the work that we're doing currently, you're going to see a different landscape of treatment, anyway, from my perspective, and prevention and well, we're part of recovery too.
Well,
but we've kind of just tried to look at all the gaps and blend it in. I mean, it's not our model is pretty simple. Just meet them where they're at and get them where they want to go.
You just nailed the crux of the problem. Yes, we have too much fentanyl coming in this country. Fentanyl is like an anomaly. That's like probably a terrible subject matter. You know what I mean? But if you look at, like in Virginia, for example, all this money we put into all these different systems. We fully fund jails. We fully fund prisons. We fully fund drug court. We fully fund tax-funded treatment. We fully fund treatment reimbursed by insurance and outpatient. But yet, that's making up half the recovery results. You look at the recovery model, the recovery systems, all these nonprofit, non-government organizations, that's where half the recovery results are coming from. Yet they get very little of the funding. So I think when we make that little funding shift over and we bring everything together, I think that's when we flatten the curve, the addiction epidemic curve. We flatten that curve, bend the curve, and get it where we need to be. And it's going to be integrating the money to what we're all doing here, and quickly too. Make it an emergency like they did COVID. See if that don't make things happen quicker. Because time's important for those people dying.
Yeah.
So
it's a small window of opportunity.
Well, our window's never going nowhere. It's the money part, and we talked how we got all this new money coming to the dance. Do we have the courage? Do our policymakers have the courage to get those funds?
To mandate that the funds go in this direction. Some of the funds go in this direction.
And is that kind of being discussed? Is that what's going on right now?
Well, we are in Virginia, and I think you are in Congress up in D.C., and y'all should be here. If you don't spell out where that money goes, it's going to go to the same old pockets.
Yeah, I'm sure we are.
Yeah.
I'm not privy. I'm not state, so I'm not privy to that.
Yeah.
Well, I know one thing. In Virginia, if we leave up to the same old people, we're going to get the same old results.
Oh, yeah. No, what I mean is, that's
right.
Jimmy's quarterbacking that.
Well,
at the direction of the state drug director. They got a pretty good team.
Yeah.
I got to talk to Jimmy about that, because Jimmy ain't so sure he knows where that money's going. So, because I probably get fired. I get Jimmy fired. I say too much. So.
That's right.
Jimmy gonna go, John who?
But what we do know is people from the political backgrounds, advocacy backgrounds, recovery backgrounds, lived experience, volunteers, families who have lost someone to an overdose are all pitching in and making themselves available.
They are.
And that's where you get that diverse solution. Because it's not a cookie cutter.
No, it's not one size fits all.
We're talking about people.
And everybody wishes that it was. It'd make addiction so much easier.
Wouldn't it?
To solve if it wasn't such a complex combination of environment, genetics, and early onset of use. I mean, those three things are really the things that influence whether someone's going to, as we call it, turn into a pickle instead of stay a cucumber, where you just can't go back and socially use it.
You can't become a cucumber again after you're a pickle.
No, once you're a pickle, you're a pickle.
I'm
a pickle.
I see you got some Wolf Street Foundation
we got some
folks.
Are you seeing some people?
Yeah, I'm gonna make sure Carol sees Wolf.
Yeah,
is it Wolf Street Gang
it's
or Wolf?
It's Wolf Street Foundation.
Right. Yeah, I've been there. It's an awesome organization. I mean, when I saw that and I saw Jimmy's
You're familiar with Joe McQueenie?
Probably.
Joe and Charlie tapes. You ever heard
Oh
those?
yeah, yeah, the
Joe
old
McQueen's from
timers.
here.
Yeah.
Okay.
Yeah, Joe and Charlie.
Right.
He started the Wolf Street, so and
Okay.
then Serenity Park, and which is a treatment center, and the Recovery Dynamics, and our clinical director is a mentee. Is that what it's called? A product of Joe McQueenie, and so he's carrying forward what Joe McQueenie left here. And you can't go to a 12-step meeting here without hearing somebody talk about the impact Joe
Well,
had.
when I saw Wolf Street, I thought this is a great recovery center. All you need is, a dozen recovery homes to go with it. You need a detox doctor around the corner so folks can detox. And if you need the MAT guy, the guy that wants to be on something longer, so you got the perfect mix right here.
Yeah.
And you make it all where it's no cost to the people that can't afford it. And you guys got a grand slam right here in Little Rock,
Yep.
and that can be the model across the state.
I believe they're the first RCO in the state.
Well, I think you're ripe to have the best model I've seen right here that the rest of the country can look at. That Arkansas, they got game. They got their act together. They got this great old-timer facility, reminds me of McShin. You got Jimmy knows how to do those sober homes, and so do many other people. It's just a matter of serving these people
And you've got
today,
private
same
sector
day.
people like you that
Yeah.
are willing
Yeah.
to take a personal risk and start a new.
You should be providing the detox for these guys. I mean, there's no reason why anybody would
No,
choose to go
we're all
use
pulling in the right direction.
when
Yeah.
they can choose recovery.
Yeah.
That's right.
And then anybody on probation,
We all
parole,
collaborate. Yeah, we're all collaborating. And we're small. It's like Arkansas is 3 million,
And remember that the opposite of addiction is connection. And right now during COVID, that's been so critically hard for us to connect in the ways that we're accustomed to. Like I was telling you, I'm doing my advocacy now on Zoom. Not my favorite format.
Not the same.
For
does
advocacy.
Kirk listen to these? He probably don't. He ain't sitting around his desk listening to this,
Who?
is he? Kirk Lang.
Jimmy just said, boy, Kirk Lane, did you hear that?
Because I just laid out the national model right here for it can start in Little Rock with the money y'all do have available for this stuff, man. Y'all'd be on the Oprah show, man. You'd be so good, man.
Well, and the team is
I want to be
enlightened.
part of that book club.
Yeah, that team is enlightened, yeah.
I mean,
Your team here is enlightened. It doesn't take as much as it might in some states.
Yeah.
Push.
yeah. But
Oh,
and,
yeah.
and
And
you
it's
got
not
all the moving parts.
antagonistic.
No.
You got
Yeah.
all the moving parts, man. And you even got bureaucrats that love recovery and they love recovering people. I mean,
Yeah.
good Lord, it don't get no better than that.
Yeah.
No, because I remember being with you.
Yeah.
Yeah.
And, that was the pain point
Right.
Yeah,
of
it
yours.
was.
You know,
Yeah.
just,
Yeah.
how do you get them? Is it the carrot or the stick? Both of them aren't working,
Yeah.
What do we got to do?
Yeah.
I know.
So-
Well, it's better. It has gotten
Yeah,
better
yeah.
in our state.
Yeah.
Well, a
They
little
are.
bit.
Yeah, they are providing funding for recovery
Yeah.
housing now, which we very much appreciate.
In
So
Virginia,
that's our
they,
next bridge, right?
in Virginia, they usually select the ones that will, kiss their butt the most and, that kind of stuff. Clean it up a little bit,
Yeah.
I know the rules.
Talk to me about that. How does that work?
So
Coverage for
in-
recovery housing, because
in our
insurance doesn't
state-
cover that anywhere in the country, and really, state-funded programs don't
Right.
have recovery housing. It's so critical, something so critical.
Well,
So in our state, I serve on the board of the Virginia Association of Recovery Residences, and the state partnered with us to become the certifying entity for recovery housing in our state. And once they were comfortable that we had the certification and then data collection, which is slowly but surely being implemented by all the members of the Recovery Residents Association that are certified, they then started giving VAR SOAR money, the state opioid response grant money, and we've gotten close to 200,000,
That's great.
yeah, over several years, both to get started.
Well, this
to-
year they just bumped it up. I think we're going to get $500,000 this
To-
year for
right, but
sober
that-
living reimbursement.
That's great.
Hasn't
Has
been finalized.
It passed.
Yeah, it
And it's
passed.
But
in
yeah,
the
it
budget.
takes a
Not the
minute.
regs,
Yeah,
you know,
needs to go
all
through
that.
review and.
But then they want to bring, one state senator wants to bring $10 million from the COVID bailout money over to VAR to be used for sober living and recovery
Supports.
programs provided by non-government organizations, and we're fighting for it to be accredited,
Oh, that would
not-
be wonderful.
not the non-accredited. See, McShin went to a lot of trouble to get that
Yeah.
CAPRS accreditation. We don't want that to be for nothing, so we think if you're going to spend money on recovery programs,
Make sure it's to
an
standard.
accredited, just
Yeah.
like it's an accredited sober house, sober living program, you want an accredited recovery
And
program.
we
You
found
have
that
to
that
provide
worked really
incentive to
well.
get that.
Yeah,
Otherwise,
yeah.
I mean, you can graduate high school and go buy a house and turn it into a recovery house.
Right.
Yeah.
You have just people who are,
And I
that's
think-
not, I mean,
Well, it's about the tax
they shouldn't
dollars,
get,
though.
but they shouldn't get funding.
They
in
don't
my
want-
mind.
yeah, they
There has to
don't-
be a standard to follow.
Yeah, the point is, if a tax agency is going to utilize a sober home, the state says that to use tax dollars for a sober home, it has to be an accredited sober.
Right, that's what I'm
Yeah.
saying.
So you can
And-
still got
Exactly.
private sector industry that's not
They
affected.
just won't be
Sure.
accredited, but that means that they ultimately won't be able to get money
The
from
funding.
the Community Service Board,
Yep.
which is the
That's how it should
entity
be.
that delivers block grant funds in our state.
That's how it should be.
Yeah, and we feel like that's one of the areas in which the relationship is working well.
Yeah.
Mm-hmm.
Some
But
of-
also, think about this, though. All those guys on probation, parole that get strung out, all of a sudden they want help. They should be able to walk into the PO and say, look, I'm strung out, I want help. Fine, we're going to get you connected to an RCO, a detox doctor, a recovery
Yeah.
house, get you off the street today. You know, that's part of the system. That's the play you want.
We have a small relationship with ACC, Arkansas Community Corrections, and we are able to help prisoners being released that are on Vivitrol. So that's they've been in a treatment program within within prison, and then when they get out, they can come receive peer support and family counseling with us. I'd like to
That's
see it evolve a little bit more
Yeah.
into a more robust partnership, but you know, it's working right now.
That's great.
So they receive from us, our organization, the peer support and family, and then they're receiving individual counseling and the medication from Arkansas Community Corrections. I think it's in a clinic somewhere that they control. So
Well, I know they just gave $5 million in Virginia for Vivitrol for
Yeah.
corrections.
yeah, I mean, talk about a huge risk. You leave, and I mean, you're pretty much you're signing your death warrant.
Open to overdose.
Oh my
The day
goodness.
you leave, the rate
You know,
is so
I
high.
sponsor guys that the longer they're on that Vivitrol, the longer they get clean. You know, people who take Vivitrol stay clean. You know, if you take it for a year and a half, might be a little bit pricey, but it's cheaper than using drugs.
It really is. And there's some characteristics that help reduce cravings with alcohol.
It does.
They're finding that
Yeah.
out too.
Yeah. Oh,
Craver reducer component in
Yeah.
it. You know, it may not
Yeah.
be for everybody, but it does help a few.
Yeah.
I just don't like it when they promote it as guaranteed to reduce cravings. You
This
know,
is all you need.
right,
Yeah.
No,
right.
it's
Yeah.
not.
I wish that was the case, that there would just be one pill and then you could be done.
I would have saved myself a lot of misery
Uh-huh.
if
Oh,
that was
yeah.
the case.
So,
yeah.
so is anybody doing detox around here, like a 5-day tape, or is everybody just going straight get them hooked on Suboxone, or do you know, is that an issue in Arkansas?
I think that it's a fairly new
Right.
idea, even though it's been around for so long. I think, what was it, 2002 when Suboxone was created?
2000.
Yes.
Data 2000.
And so
is when-
it's been around for a while, right? However,
20 years.
it's coming up. We talk about the eyeballs on everything. So now these deaths have the attention of the medical side of the house, and so they're wondering how to do it. And so they got to go through the DA waiver and all these processes, and there's some stigma. We've heard reports that I don't want to get the DA waiver because I'm going to have those people come to my clinic all the time. Well, fine, you don't need to get it.
And
you know, but,
there's legislation pending that would remove that X waiver too.
Yeah, I've seen a little bit of that. But to answer your question, yeah, we do. I mean, our facility is we're under a recovery umbrella. We're not serving abstinence. We're not serving MAT. We're
But
not
what
serving.
I'm saying,
But you know what I mean? Like,
can people
we're
get
gonna meet them where they're
detox
at.
if they want?
Yeah.
You do a 5-day buprenorphine
Yeah.
detox.
Yeah, we have a.
Do you do many of those?
We,
And you don't know.
we
or-
open March 1st.
Oh,
He's day 3.
hell
We're figuring
yeah.
that out.
Well,
But we have a great team medical staff. Our medical director, Dr. George Konis, is incredible. He's an addictionologist, been in the field for 20 years, and
I'd like to meet
is-
George.
yeah.
Because we do both at McShin. You got, a lot of guys, they want to get off of drugs. They don't want to do maintenance. But then some want to do maintenance. They don't
Yep.
want to get off drugs. So, but I think the perfect system is the one that opens the door to consumers to choose which
Yep.
one.
That's right.
Because if you get a guy or a girl who wants to get off drugs and they're surrounded by motivated hope dealers, it makes the pathway look simpler and less challenging. They're going to want to do that, you know. But if you get kids that just want to get high, they just, you know, they're not going to want to give up that get high drugs. So, you know, there's ways
Yeah.
to skin the cat.
Yeah,
But
you got to give them the information
But
and
I-
help them make that
But
decision.
in Virginia, these agencies, they just putting them all on maintenance.
Immediate.
Yeah, they're not
We see
even
that.
really trying to help
We see
them.
it.
And
there's no
inducing them
treatment.
at
Right.
high milligram levels, and then
Yep.
it makes them impaired
Mhm.
and harder to.
It-
I'm
it-
not.
it
This is
kinda
not an
itches.
anti.
It itches something,
MAT,
right?
Well,
yeah,
it keeps the
I'm-
You have to-
dragon alive.
You have to find,
the balance.
yeah,
But what happens if you're in an environment like we are, which we're grateful for, that it's such a recovery-rich environment? If one that we call them OBOTs, office-based opioid therapy.
We're seeing a lot of those now.
One doctor's practice that induces people at 16 or even 24 milligrams, then the rest of the doctors start having to do that, or else all the people seeking MAT recovery
Go
all
to
go
that
to the
doc.
one doctor that's inducing at high levels.
And 60% diverted for
that's
resale
not
on the
surprising.
street.
So
Not
it's
surprising.
not. It's the way.
I mean, it makes perfect
it's-
sense.
It's the behavior of addiction,
Mm-hmm.
yes. And so I think one of the things that's necessary is that there be a little bit more oversight, both federal and state. And it's really a state regulatory authority. The state medical board
Right.
is who has oversight authority. You know, you shouldn't charge a patient more if they want to taper off, for example. You shouldn't be able to prescribe buprenorphine for methamphetamine addiction, for example. It
No.
has no
There's-
credible,
Yeah, I mean-
yeah. And we see some of that,
Yeah.
unfortunately, where we are. So those kinds of practices need to be regulated
Right.
by state medical boards.
I also think, I mean, yeah, you can remove the X waiver, but something that goes along with that is about a 15-hour
Hour
course.
course, yes.
And I think that needs to stay, because you have a lot of doctors that took 1 hour in their education on addiction.
Yeah, most medical schools don't teach it.
Right.
Let me ask
What
you
they do,
a
it's
quick
so
question. How many people that go to these OBOT clinics and these Suboxone clinics are addicts? Like 100%, right? How many people go to jail and prisons, suffer from substance use disorders in one form or another? I think that's hovering around 80%. So my point is this: we should have people in recovery in serious management positions in these agencies, and that eliminates a lot of this abuse and mischaracterization of what these drugs should and shouldn't be doing. And that goes for wherever there's addicts and alcoholics. If they're in large numbers, you should have large numbers of administrators, leadership, decision makers, policy makers,
Yeah.
because that's part of the problem right there.
But
Yeah.
right now, in the OBOT space, these medical practices, and again, I don't have anything against MAT at all. It is an incredible tool in the tool belt. But the way that it's used matters.
It needs to be comprehensive. It's a part of the
And
comprehensive
there needs
approach.
to be peer support along with it, those
100.
kinds of things.
We want recovery outcome approach, not business dollars approach, and
Yeah.
that's what it's turned
But
into.
what has really changed the landscape of these, because I remember I worked with ASAM for over a decade, the American Society of Addiction Medicine, the Trade Association for Addiction Professionals. Private equity came in about 5 years ago and just invested like crazy in these practices, and then made nationwide chains of them in some instances, or provided money locally for the evolution of these practices because they saw they were a moneymaker. And so they didn't buy just treatment centers, they also bought and expanded the use of these office-based opioid therapy clinics. So
You
that
said
is,
these capital funds, so they went out and scooped up a whole bunch of,
yes.
so yeah.
Well, you know, that's a growth industry, but it's a growth industry that's going to outpace the need for what we really need it for, so they're going to have to invent customers. And the growth of the industry is going to do the invention of the customer. 60% of these drugs are diverted for resale on the streets. That tells you right there, we got a big problem,
Yep,
you know.
huge.
And as long as there's oversight, but I think that, at least in Washington, I can speak to this, when there's been a huge federal investment made in a strategy, they're very, they're not inclined to do studies that say, has this been effective? Or head-to-head studies, for example, of Vivitrol and Suboxone. And, you know, the manufacturer of Suboxone is, their former CEO is in jail. They've paid a $2 billion fine plus. They're, you know, they hired the Purdue marketing guy to come up and market in our state in the mountains. I mean, you know, it is worthy of oversight.
Absolutely.
Is, I guess, the combination of quick, fast money injected into that system and the fact that state medical boards are much busier on other matters and really don't have time to do the kind of oversight that's necessary.
Yeah,
in a fast pace growing.
And I think the stigma, once again, they really hard on our illness. You know, look at just use Ebola for an example. Wasn't that the illness that came to America and they spent a lot of money worried it was going to come here? Was it that one or another one? Where
like the outbreak?
That was Zika.
They spent like
Zika.
80
Zika.
maybe it was
Zika.
Zika, $80 billion
And
that they spent
materialize.
to try to
Ebola
get
came
ahead
here.
of something.
Yeah.
They only had a few cases, but the point is, it was like, well, we prepared, we did our best, better safe than sorry. But when it comes to addiction, it's a whole different animal, you know, better safe than sorry. Oh my God, it's like, you know, it's all over the place.
Yeah.
Well, but we're always going to have to deal with the reality that people in the acute phase of this illness commit crime.
Yeah.
And so, you know, that doesn't happen. When
Yeah, that does seem to be a problem with stigma. I beg them all to, please, man, quit committing crimes, man. We get a lot more done if you stop being bad.
Yeah.
You know? Go, you know, bring back opium, you know. Should have never outlawed it in the first place. You know, how many people you know overdose from opium? I don't know anybody smoking opium that overdose.
Oh, the hard part to accept for me is when you know that there's a batch of fentanyl that's killing a dozen people. You get the people coming from all over. Hey, hear that?
They're
and it's
seeking it out.
It's like a moth to a flame.
Yeah.
Yep, that's the one problem with
That's
this
hard
disease.
to accept. Like, stay away from this right
Well,
now.
and it's so understandable for those of us who have been in that world.
Yeah, but then you
and other people are just scratching their heads like, why would people seek out a drug that has just killed two of their friends?
Yeah, like, or I've seen they deserve it if they're going to keep doing that. Well, they don't understand the illness behind it.
Yeah, they don't.
That's why I'm sitting here looking at this beautiful woman, Michaela, that was on our show, 12-time overdose survivor. Now she's turning that into passion and productivity, you know. And that's why we don't let them just
your
die.
brain gets hijacked, and it's a very hard phenomenon to explain.
Yeah.
Unless, I mean, you know, we would not go and run into that wall over there intentionally now that we're clear-headed. But when you're using, if someone told you there were drugs on the other side, I'd absolutely continue to repeatedly run my head into a brick wall.
Somebody's commented, Paul Kalkbrenner.
Yes.
He says, it's hard to trust farmer on keeping the interest of the consumer first, you know, given their past experience. And I just look at the Biden administration putting that woman in charge of the FDA who passed that real powerful painkiller drug against everybody's suggestion. And farmers not, I mean, big pharma, they ain't trustworthy. I hope this COVID vaccine I got worked, you know. I hope I can trust that one, you know.
Yeah.
It's already in me now, man.
It's
Can't
there.
get it out.
It's there.
Yep.
So,
Well, hey, we've covered a lot, and certainly we're open to having you back anytime that you want to be on the clinic. There's, you know, with 38 and 23 years, there's a lot of history there to uncover. And,
well, we know where
want to
you're
hear
at.
about the future.
Yeah.
But before we sign off, is there anything you'd like to tell our viewers that I didn't ask or we didn't cover, just as a closing statement?
You know, if you're a person or a family member who has a loved one struggling with addiction, I think if I had to sum up with everything that we've talked about today is there is hope for you or a loved one to get help. There are people like us all over the country and all over your state. And so if you need help, call Chris, let people know, because there are people here to help you who care.
You know, I was gonna say what Carol said, but see how great minds think alike. So I'm gonna ask if there's
You
any.
airdropped it?
Well, no. What I'm thinking, I'm gonna ask the bureaucrats and politicians that are watching,
There
and
you
the
go.
agency leaders that are watching. You know, I think the recovering people are a powerful tool. You know, we can get a lot of results. So let's. And some of you are already figuring out a way to collaborate and get things done. But now's the time to accelerate getting things done, you know, utilizing us more and more and valuing us more and more. So, you know, before you make big decisions, if it's centered around substance use disorders, please make sure good thinking recovery people are in the mix so we can get the best ideas and the best solutions. So, you know, it might be your loved ones coming along catching this illness. So you want to make sure you can look everybody in the eye and say, look, we made our best decision based upon best information from those that been there and done that. So, you know, we do appreciate you letting us on. I'm so sorry Jimmy McGill couldn't be in the room. Breaks my heart.
He's in the comments.
He's in the
He's not
comments.
saying
and,
none of those.
Jimmy, we're going to spend plenty of time together. Don't panic, you know.
Yeah.
But
Well,
Chris, you've done a great job. And this show, I talk about this show. So I appreciate your funders letting y'all put this show together. I think it makes a big difference. So
We appreciate
it was
that.
money well spent, you know.
Yeah.
Now, granted, whoever funded the show and put it together, I would have recommended more. You know, I know you got some like great radio faces running the show, but might have done a little better in that area, but not bad. So, but you guys did great, man. You're good.
Yeah.
Thank you.
Thanks for
Well, thank you
including
so
us.
much. Absolutely. And we'll be here next Wednesday, as always at 11 a.m. If you know someone who's struggling, reach out to us and we'll provide them with some resources to get them some relief. There's no reason to be an island of one. Addiction wants me isolated, and you know, as long as I'm in the middle, I can't fall off the edge. So we hope that you join us next week. Jimmy will be back in the studio.
Hey, Jimmy.
Thank you so much.